Not all tumors in your uterus are the same. Some are scary, some are bad, some are problems, and some just are, and they won't even bother you. Hi, I'm your local OBGYN. I love women, and let's talk about it. So, tumors in your uterus. I hate calling it tumors, but like fibroid tumors, okay? They are basically overgrowth of this big, beefy muscle, which is your uterus. Your uterus is like a pear shape upside down, and it is really thick muscle tissue, and there's a lot going on with it. It's not just like a bicep that's like sitting there getting worked out sometimes, or being lazy if you're not somebody that likes to exercise. Your uterus is doing things every single month. It is strong enough to push a human being out of a body for most people. It's strong. There's things happening. But it can grow these muscle overgrowths, and the muscle overgrowth is made of the same thing, but it kind of has this like more circular look to it instead of like layers. And these circular layers can do a bunch of different things. They can grow inside the uterus, and that is a submucosal fibroid. Those ones cause yuckier bleeding and maybe more uncomfortable cramping. They can grow in the wall of the uterus, an intramural fibroid, or they can grow outside the uterus on like a little stalk, almost like a Mickey Mouse ear. Now, most of these are going to be benign. They may cause you heavier bleeding, more cramps. They can actually cause you pressure if they get really big, because again, they can be like the size of a dime, or they can be the size of a baby. And if they get big, they can push on your bladder and your bowels. You should still be able to void and go poop, but it can be uncomfortable. Or they can be more problematic if they do something naughty. And the naughty things they can do is they can grow so big that they actually start to like break down in the middle and necrose, and that can be painful. Or they can actually be something more problematic like cancer, and they can turn into a muscle type tumor called a sarcoma. Those things are dangerous. These are fibroids that show up quick, grow quick, and usually look a little bit different, and they have to come out because they are dangerous.